Okay, so what other problems are we facing with marketing? What are your current problems with your marketers that you have, if you actually employ them? A lot of companies will say, well, I actually do not have a marketer. I don't have one. Another thing that rises up sometimes is, or I don't have a full-time one. Or I'm the jack of all trades. Literally, I'm the DON, I'm the administrator, I'm the owner, I'm the president. I'm also the biller slash marketer slash janitor. I love mom and pop's home health agencies. That's how I started. And it's amazing how you can build something from the scratch and have it grow so much. But if you don't allow yourself to grow, you're never going to grow. Other problems that a lot of companies face with their marketers is that their marketers jump ship. Their marketers decide to go, well, let me go to greener pastures. They're going to offer me more money, so I'm going to start working for that agency. So they leave your agencies. Or one thing that always comes up is that, well, we have a marketer, but when I ask them, well, what are they doing right now? A lot of times they will say, I don't know what they do. You need to know what they do. You need to be able to get those reports. And what we actually do is we put together, we have a virtual sales management team over here at Home Health Success Academy. And what we actually do is that your marketing team will get an hour a week from us that we will actually train them or give them a little bit coaching that they need, or if they have any questions, they can definitely ask us. At the same time, on a weekly basis, they need to report to us on how many leads they actually opened up, who they met, who they followed up with, how many admissions they got, how many discharges was happening. We want to make sure that we get all those information, and then we will put a report together and give it to the owners, the administrators, the DONs, whoever's in charge of your agency, to give you guys a full report to show you guys, and so that you know what your marketers are doing. And at the same time, it gives you an opportunity to be able to spot check them, to follow up with them. Because countless times, sometimes it happens where owners or administrators will say, well, I really don't know what my marketer did within the past 2 months. And if you ask them how many referrals did they bring, well, I don't know. Actually, I think 5 or 6. You need to be able to know specifically how many admissions did they give it. But at the same time, is how many admissions did they bring that actually stayed, that were good admissions. These are things that you need to be able to know and quantify out.